Lagos pushes bold health agenda, engaging over 800 ILERA EKO providers at Annual Forum. The Lagos State government is accelerating efforts towards universal health coverage, engaging over 800 healthcare providers at the 2025 ILERA EKO Annual Forum. Organized by the Lagos State Health Management Agency LASHMA on 2nd of July 2025, the forum focused on strengthening and enhancing healthcare delivery across the state. In attendance were permanent secretaries, chief medical directors from various healthcare facilities, chairman of various medical associations, and heads of health agencies. Let's join Sholaide Olawoye for more details.
Over the years, health has been considered as a complete harmony of the body, mind, and spirit. That is why Lagos State Health Management Agency (LASHMA) organized 2025 ILERA EKO Annual Program focused on the well-being of the citizens. Chairman of LASHMA, Dr. Adebayo Adedewe, announced a series of bold reforms, including performance-based incentives for providers, expanded services through community pharmacies, and an increase in the equity fund from 1 billion naira to 3 billion naira to support vulnerable populations.
This year's theme, driving universal health coverage through strategic partnerships, is both timely and intentional. It speaks to the progress we have made together and the collective resolve we must sustain to ensure that no resident is left behind in accessing quality health care. Through the Lagos State Health Management Agency (LASHMA), the state government has worked tirelessly to expand access to affordable, inclusive, and equitable health services. To accelerate this journey, His Excellency Governor Babajide Olusola Sanwo-Olu issued a landmark executive order on July 16, 2024, mandating the enrollment of all residents of Lagos into the ILERA EKO Social Health Insurance Scheme. This bold directive reaffirms the state government's unwavering commitment to health equity, financial protection, and social inclusion, especially for the poor and vulnerable.
Permanent Secretary Dr. Emmanuel Lazamba revealed that enforcement of mandatory health insurance in Lagos will begin in 2026, encouraging residents to enroll early under the ILERA EKO scheme.
The first thing I want to tell Lagosians is that now social health insurance is mandatory in Lagos State. Enforcement will start in earnest early next year, as was mentioned during the program. But this is a period for us all to be aware, to ask the necessary questions, and to generally join this bandwagon, because universal health coverage anywhere in the world that it has advanced is usually by compulsion, and that means that everybody now has to key into it. Because let us face it, government cannot do it alone. There are people within our community that cannot even afford to pay 1 naira for care. Somebody has to pay that money. Government is paying that money on their behalf, but of course government cannot do it alone. So all of us have to contribute to this pool, and then we'll be able to take care of even more people. People are assured that they will not be financially impoverished if illness comes visiting. So please, join this bandwagon. You will find that it is something that will add to quality of life for your family. Once you've set aside this small amount of money, you can now use money to do more important things, like sending your children to very good schools, building a house, and generally having a good quality of life for you and your family members.
Delivering a goodwill message, Dr. Olufumi Bankole described LASHMA as a game changer, saying the agency has brought much needed relief to countless families and is making a visible difference in healthcare access.
LASHMA coming on board in Lagos State is a game changer, and I want you to celebrate LASHMA for that. It has been an answer to prayers for some people. It is that point where many people would have given up on life that LASHMA comes in and makes the difference.
In recognition of excellency, some of healthcare providers and outstanding pharmacists were also honored at the event. In a move to strengthen accountability, LASHMA also introduced biometric verification system aimed at reducing fraud and improving service quality. Health stakeholders commended the agency's impact and called for sustained professionalism, innovation, and ethical service delivery in the drive towards universal health access. Shalaide Olawaye, reporting for Lens Africa TV News.
And that is all we have for you on the News Hour from Lens African TV. I am Kudrat Ibrahim.
Lens Africa Television, the mirror of the continent.